Thank you, Raymond. So tonight's topic, as we told you, is about Medi-Cal waivers. You have to think of waivers as a service that Medi-Cal provides. And so I'm going to talk about what waivers are. There are different kinds of waivers that do different things. The focus of this training is on waivers under the umbrella of home and community-based services waivers. So you have to think of home HCBS waivers as an umbrella, and then we're going to talk about all these waivers in California. You might be familiar with one of them. If you're a regional center consumer, the DD waiver is one of these home and community-based services waivers in the state of California. So to understand the waiver, we have to kind of go back in time and talk about when the Medicaid program came about. States could decide whether or not to participate in the Medicaid program. And if a state wanted to participate in the Medicaid program, it had to submit a state plan to the Centers for Medicare and Medicaid. That's the federal agency that administers Medicare and Medicaid, two different programs. And that state plan includes who would be eligible for the different Medi-Cal programs, what kinds of programs do we have, what services, what are the rights, et cetera, et cetera. If you want to look at California's state plan, the link is there in the bottom. In California, we call the Medicaid program Medi-Cal. Every state can decide what they want to call the Medicaid program. We call it Medi-Cal. So when the state wants to amend the state, change something that was already approved, it can either submit an amendment to the state plan, or it can seek to waive some of the provisions in the statutes that concern Medicaid and waivers. And I'll talk about what some of those provisions are. So it allows states to not comply with all of the rules that the federal government has, because they, when the state agreed to participate in the Medicaid program, it agreed to follow all the rules. So a waiver is waiving some of those rules provisions. And we'll talk about them in a minute. So we have what are called Section 1915C of the Social Security Act waivers, and those are the home and community-based services. Responsible for doing that. So we are going to find, okay, here we go. So I opened up the link, and here we are, Department of Healthcare Services, Medi-Cal waivers. It talks about waivers. It talks about current waivers. So we've got all kinds of waivers. And then we've got the 1915C Home and Community-Based Services waiver. Waivers under this waiver currently, we have the Medi-Cal waiver program, was formerly known as the AIDS waiver, assisted living waiver, the home and community-based alternatives waiver, the home and community-based waiver for the developmentally disabled, that's known as the DD waiver, the multi-purpose senior services program, the MSSP waiver, and then there is also the self-determination waiver. So these are the current waivers. If you were to click on any of these, you would go to the actual waiver document, the document that was submitted to CMS for approval and the approved document. And these documents are sometimes more than 400 pages. And we're going to open up the DD waiver so that you can look at it. So when we talk about waivers, we're talking about extra services for subpopulations of people in the state of California. Not everyone can qualify for a waiver who has Medi-Cal. So that's the link that I just went to. Now let's focus on the HCBS waivers. What are these waivers? These are waivers. What's the goal of these waivers? The goal of the waiver is to provide the necessary care at home so that the person does not have to be placed in a facility that's paid for by Medi-Cal. Those requirements that the federal government agreed to waive for the waivers, one of them is comparability. So typically, under the rules, the states have to make services like people who have full scope Medi-Cal. They're supposed to, the comparability that everyone will have the ability to ask for all of the services. And statewideness is that the state of California can't offer Medi-Cal to just certain sections of the state, like Northern California, Southern California, or some counties. No, if you're going to participate in the Medi-Cal program, you've got to make that program available throughout the state. And sometimes income and resources are also waived. But the big ones are comparability and statewideness. So what do the waivers do? So it allows the states to tailor services that targets particular groups. So by age, diagnosis, etc. So subpopulations of people get these extra services. Not everyone in the state of California who has Medi-Cal can qualify for a waiver or has the access to all the waivers, as we will see. For all of these waivers, one of the criteria for eligibility is that you have to show that if you were not living at home, you would meet one of the levels of care in that particular waiver. And that requirement you'll see in all of these home and community-based services waivers. And under these waivers, the state can choose the maximum number of people they want to serve under the waiver. So some of these waivers will have waiting lists because the slots have been used up. The only waiver that traditionally has not had and does not have a wait list is the DD waiver. It's got a lot of slots. So when the state is asking the federal government to approve these waivers, the state has to show that providing services under the waiver is not going to cost more than if they had to provide those services in an institution. That's called cost neutrality. They have to make sure that the person who is being given services under the waiver, that their health is protected, that they're adequate and reasonable provider standards, and that services follow an individualized and person-centered plan of care. So these are the current waivers in the state of California. The AIDS waiver is available for people. Now, this is not all the criteria for all of the waivers. I'm just sort of giving you the target population in the service area. So as you can see, for example, the assisted living waiver is only for people who are disabled, also over 21 or over, and it's only available in 15 counties. The alternatives waiver is for anyone who's disabled, any age, available throughout the state, as is the DD waiver. To qualify for the DD waiver, you do have to be a consumer of the regional center. So if I'm not a consumer of the regional center, I cannot apply for the DD waiver. The MSSP waivers for people age 65 or older, available in 46 counties. And the self-determination waiver is also a waiver that's available through the regional center, and it's available statewide. So you can see how these waivers serve subpopulations of people with extra services. So let me give you a really good example of what that I mean by that. If I have Medi-Cal only, and I'm at home, but my health is such that I need the services of a nurse, I can't get just with Medi-Cal, I can't get a nurse to come to the home and take care of me. I can try to piece together things, maybe not even IHSS would help me. for what my needs are. Try to make it as, because I want to stay home. I could try to do what I can, but I don't know. The other option is I can go to a nursing home because Medi-Cal pays for nursing homes, but I don't want to go to a nursing home. But if I apply for one of these waivers, for example, the alternatives waiver, the DD waiver, and I meet the criteria for the waiver and for the service, I can get a nurse to come to the home. So if I'm on Medi-Cal without the waiver, I don't get a nurse at home. If I'm on Medi-Cal and I'm on the waiver and that waiver provides for nursing services at home, then I get that nurse. Okay, so that's the difference. So one of the things to be mindful of is you can't be on more than one waiver, period. So for example, if I'm on the DD waiver, I can, and if I qualify for any of these other waivers, I can decide to get on that waiver, but I'd have to give up the DD waiver. There are some regional center consumers who are not on the DD waiver. They may be on the alternatives waiver or another waiver. Just because you're a regional center consumer doesn't mean that you have to be on the DD waiver. But you can only be on one of these, so you have to decide if, obviously, if you qualify, which one you want to be on. How do you know what services the waivers offer? You go to the waiver, and I'm going to show you the DD waiver so that you can see that. I mean, if you were to ask me, well, Maria, which waiver is best? I really don't know which waiver is best for you. We would have to understand your situation. You'd have to look at the waivers. You'd have to look at what services are available. Also, is there a wait list for the waiver that you want to get on? There might be a wait list. So lots of factors. This link gives you a comparison of some of the services under the alternatives waiver versus the DD waiver. So you might want to look at that. It's not an exhaustive study, but it gives you an idea. Let's talk about the DD waiver. There's no wait list. If you want to apply for the DD waiver, you go through the regional center. So you'd be talking to your service coordinator about that. And the DD waiver is here. I'll come back to it and we'll open up the link so that we can look at the waiver. To be eligible, you have to be an active consumer. What does that mean? You have to be receiving at least a service. And yes, there are people who are regional center consumers who are not receiving services. But you have to be an active regional center consumer because it's a Medi-Cal service. Of course, you've got to be eligible for Medi-Cal. And you've got to qualify. If you were not living at home, you've got to qualify for care in an intermediate care facility. There are 3 levels in the DD waiver. Of course, you can't be enrolled in another HCBS waiver. If you are, you've got to disenroll. And so the main purpose of all these home and community-based services waivers to keep you out of an institution and in the community. Sometimes when I was doing casework, I would ask, well, what waiver are you on? Well, I'm in the institutional deeming waiver. There's no such thing as an institutional deeming waiver. As you've seen in the list of waivers that are available in the state of California, you didn't see a waiver called institutional deeming waiver. It doesn't exist. What does institutional deeming mean? Under the general Medi-Cal rules, if you're a minor applying for Medi-Cal or a spouse applying for Medi-Cal, the income and resources of your spouse or the parents with whom you live will be counted as if they were yours. And that can make a child ineligible for Medi-Cal or a spouse ineligible for Medi-Cal. If you qualify for waivers that have this language that says that if you qualify for this particular waiver, then Medi-Cal eligibility worker, you're going to pretend that the person is living in an institution and therefore there's no deeming of parent income or resources or spouse's income or resources. So there are children who could not qualify for Medi-Cal under the general rules who may qualify for Medi-Cal if they're on a waiver that has this language of institutional deeming. So the DD waiver has that, the alternatives waiver has that, the MSSP waiver has that. So there are waivers that have this language, but there is no such thing as an institutional deeming waiver. It does not exist. Again, the process, you have to go through the regional center. So if you're receiving services through the waiver, the regional center can't use purchase of service guidelines to limit the services. In fact, what the waiver does is it helps the regional center pay for the service because now Medi-Cal is paying for it. So rather than, let's say that you need nursing services and you don't have you're not on a waiver. And Medi-Cal is not going to pay for nursing services because generally it doesn't pay if you're not on a waiver that provides that kind of service. So if I'm not on a waiver and I need nursing services and I'm a consumer of the regional center will have to pay out of its own budget. But if I'm on a waiver, like the DD waiver that provides nursing services, then those nursing services are not going to be paid for by the regional center. It's going to be paid for by Medi-Cal. So it actually helps the waivers help, or this DD waiver, the other self-determination waiver actually helps the regional centers pay for services that are in your IPP and that are covered by the waiver. If a child loses Medi-Cal and then loses the waiver because you've got to be on Medi-Cal to get these extra services, then the Medi-Cal should not be cut off right away. There's something called continuing eligibility for children. So the child will have some more time to be on Medi-Cal until termination. So, and it could be up to 12 months. So just know that. But hopefully no one loses their Medi-Cal. So some of the services that are available through the waiver are the ones you see here. We're actually going to go to the waiver. I'm not going to go to the section that has all the services, but I'll tell you where it is. We also have our rights under the Lanham Act Manual. Chapter 11 talks about the DD waiver, so you could go there and learn more about the DD waiver. Like all Medi-Cal services, you've got to show medical necessity to get the service. So with the DD waiver, you've got to show that what you're asking for is reasonable and necessary to treat the disability or developmental condition, and the service has to be specific, effective, and skilled. Let's say you become eligible for the DD waiver. Eligibility will be reviewed at least annually. They have to make sure that the consumer still meets the waiver criteria. And there are people at the regional center, they're called qualified intellectual disabilities professionals. They are the experts on waivers. And so, okay, so let's go now, before I talk about the self-determination waiver, let's open this link. And we're going to go to the DDS website. Remember that all these waivers are available on the Department of Healthcare Services website, but because the DDS administers the regional centers and you're applying for the DD waiver through the regional center, the waiver will be found also on the DDS website. So here we go, 1915C waiver. We've got a primer and policy manual, lots of good information about the waiver, pending waiver amendments, and then we've got the current waiver, approved waiver. So we're going to go ahead and open it. Usually what you see in the beginning of the waiver is a letter from CMS, Centers for Medicare and Medicaid, that, sorry, I was showing the waiver before in it. This is a letter that says we approved your amendments to the waiver. Your amendments were these amendments. And then attached to the letter is the actual waiver document. Oh, you can't see it. Okay, well, let me Let me know if you can see it now. So this is the letter followed by the actual waiver document. Remember, this is the waiver document that the state of California sent to CMS to waive certain federal requirements. And this was, it's a 407 pages. And it talks about the effective date of the amendments are January 1st of 2025. The actual waiver, every 5 years, it has to be approved. So the last time it was fully approved was in 2023. So 5 years from then they've got to reapply for the waiver. So it's every 5 years, but they can make amendments as needed. And then we've got the different sections. Section A is about the waiver administration and operation. B, all the criteria for eligibility for this waiver is found in Appendix B. If you want to know what services are available, who can provide the services, you're going to go to Appendix C. And other things, for example, your rights under the waiver, safeguards under the waiver, financial accountability, cost neutrality. How did the state show the federal government that providing services under the waiver would not cost more than providing services in an institution? So it's all here. And all of these home and community-based waivers have the same format. So if you open up the Medi-Cal AIDS waiver, the assisted living waiver, whatever waiver you open up, the format is going to be the same. So for any of these waivers, if you want to know what services are available, go to Appendix C. If you want to know the eligibility criteria, go to Appendix B. They all have the same format. And then here we have, it's a 5-year waiver. It was approved 1/1 of 2023. Levels of care. Remember, you've got to show that if you were not living in an institution, you would qualify for any of the levels of care as outlined in the waiver. So this waiver says that you've got to qualify to enter either an intermediate care facility for the developmentally disabled that has its own criteria, or the habilitative level of care, or the nursing level of care under ICF. And where are you going to find the eligibility criteria? In Appendix B. And then a brief description of the waiver, who administers the waiver, et cetera. And then you start with the different appendices. So that's what it looks like. That's the waiver. So moving on to the self-determination waiver, there are people who are in the self-determination program through the regional center, but they're not on the self-determination waiver. They may still be on the DD waiver. So don't get confused. Just because you're in self-determination doesn't necessarily mean you're in the self-determination waiver. Again, the services that are available that could help the regional center pay for services listed in the IPP are going to be in Appendix C. And so I have a link to the waivers, to the self-determination waiver and information on the self-determination waiver. So if you want to apply for the self-determination waiver, it's a conversation with the service coordinator because it's administered by the regional center. The home and community-based alternatives waiver, children, adults can apply for it. There is typically a wait list, but I'm not going to go through this because it'll bore you to death and you can look at it. You're going to get this, but there are certain people who get priority on the waiting list, and you can read all about it in these next slides. It's just more information for you to have. So not everyone, has to wait to get on the waiver. It depends on whether you are can be given a priority. So the home and community-based services waivers the needs are individualized. Your doctor has to approve a plan of treatment. And the levels of care in this HCBA waiver, I know because I worked a lot with this waiver, are nursing facility level A, B, subacute, acute, and intermediate care facility, continuous nursing, which is the highest level of care in the ICF world. So if you meet any of the criteria for any of those levels of care, then you're on your way to being approved. Services, these are just some of the services that are provided. Again, you would have to go to Appendix C of this waiver to look at all the services that are provided. Private duty nursing. The DD waiver also provides for private duty nursing, personal emergency response system, home respite, habilitation. The waiver is right here. You can go to DHCS and look at the waiver, the DHCS website. Waiver personal care services is available through this waiver, not any of the other waivers. So these waiver personal care services are combined with IHSS. So you have to be receiving IHSS and be on this waiver. And so I've seen this used in the following scenario. It's not unusual for a nursing agency to say to you, we don't have enough nurses to meet your care needs. Okay, under this waiver, I can, if let's say I'm the person who's receiving services under this waiver, if my doctor agrees that someone who doesn't have the level of care required, nursing, is trained, that person can provide the services. So I can't find that nurse, but this person there's criteria for applying for waiver personal care services, and my doctor has to approve it. So if all goes well, then I can use someone who's not the person has the license that I need, but can do the work. I've seen that being used in this scenario. There's more information on waiver personal care services, frequently asked questions. So you can, if you want more information on this, you can go here. But remember, this is only for this waiver. It's not, I remember doing a training and someone asked, well, I applied for waiver personal care services and they were confused. They thought that the son was on the DD waiver, but the DD waiver doesn't provide waiver personal care services. So the son must have been on the alternatives waiver. How do you apply? You apply through what is called a waiver agency. And you can go on this website and find them. There are certain counties where you have to apply directly within home operations, which is a division within Department of Healthcare Services, but you can find all that information. You call them up and they're going to ask you questions. You're going to, there's going to be an application. There's going to be a nurse that's going to come out to the home to assess needs. You're going to have a plan of care from the doctor. There's a process and they can explain it. Moving on to the assisted living waiver, you have to be living in either residential care facility or subsidized housing. Obviously, you've got to be on Medi-Cal, age 21 or older. And like all these home and community-based services waiver, if you are not living at home, you meet any of the levels of care as outlined in this particular waiver. The only counties where this waiver where the waiver is available are the ones you see here. So if you don't see your county here, then it's not available in your county. Services include companion services. They have someone on site 24 hours to help with scheduled or unpredictable needs. They have personal care services, chore services. Where do you go to find out all the services that are offered through the assisted living waiver? You go to the assisted living waiver, which is right here and in this link, and you go to Appendix C, and that's where you're going to find all the services. How do you apply? You call the Care Coordination Agency, and the information is here. So you notice that waivers have agencies, entities that you have to apply through to get on these waivers. The next waiver is the Multi-Purpose Senior Services Program. You've got to be 65 years or older and disabled. Again, you have to show that you meet any of the levels of care in this waiver. And it's available in about 46 counties, so you can go on this website and find out if your county is there. If your county isn't there, then it's not available to you. Services include what you see here: respite, transportation, meal services, adult daycare, and many, many more services. Go to Appendix C of this waiver and you'll be able to see all of the services. And you apply through the Department of Aging, and the link is here. And lastly, the Medi-Cal Waiver Program, formerly known as the AIDS Waiver, provides comprehensive case management and other services that you can find in Appendix C of that waiver. And you've got to have a written diagnosis of HIV/AIDS. You've got to be healthy enough to be able to receive care at home. And of course, you've got to meet one of the levels of care in that waiver. And I've got a link here to finding providers. And where do you apply? You apply through the Office of AIDS. So we have come to the end of the presentation. We're going to go ahead and stop the recording. And Mary, I'm going to hand it over to you.